Wisconsin's insurance commissioner is responsible for implementing a number of the health insurance related changes in Wisconsin's new COVID relief law. This is a law that was signed by Governor Tony Evers on April 15th. And the insurance commissioner has issued a bulletin to try to help explain some of the major insurance provisions of that law. And they fall in about 5 categories of out-of-network charges and payments, anti-discrimination language, cost sharing, prescription drug limits, and healthcare liability coverage. Let's look at some of that out-of-network language first. Now, in the law, it indicates that insurers offering a defined network plan or a preferred provider plan are going to be required to provide coverage for services, treatment, or supplies for COVID-19 from non-participating providers. This is a requirement when access limits exist because of the public health emergency, but it also applies more generally when a participating provider is simply not available because of the public health emergency. So the law says in this instance, the plan may not require the insured to pay, including cost sharing, an amount greater than that insured person would have paid if the services, treatment, supplies were provided by a participating provider. Now, in the guidance, they also help explain what percentage of reimbursement the provider is going to get for some of these out-of-network services. And it indicates that providers must accept this as payment in full. The effective date for this change is March 12th through 60 days after the termination of the declared public health emergency. Let's look at that anti-discrimination language in the law next. Insurers cannot discriminate against consumers with suspected, current, or a past diagnosis of COVID-19. This applies to rules of eligibility for canceling coverage. You can't modify rate filings, and you cannot refuse a grace period. All of these are prohibited activities if someone is suspected of having COVID, has COVID right now, or had a past diagnosis of COVID-19, either when the insurance was issued or when it was renewed. There are a number of types of plans this applies to, and we list those on the slide. And this includes those individual or group coverage plans through a health benefit plan, pharmacy benefit managers, or non-federal government self-insured plans, as well as some of those limited health service organization plans. Let's look at the cost sharing language in the law. The law requires coverage of testing for COVID-19 without copayment or coinsurance. And this is true if that plan or policy the person had included coverage for testing of infectious diseases. And again, the language of the law and the bulletin helps describe which types of plans this cost sharing language applies to. The prescription drug limit language in the law is actually a prohibition. The policy or plan that covers prescription drugs are prohibited from requiring a prior authorization for early refills of a prescription or otherwise restricting the time period a prescription must be refilled. It imposes a limit on the quantity of prescriptions that may be obtained if that quantity is no more than a 90-day supply. Now, this prohibition does not extend to some prescription drugs, such as some controlled substances, and that's actually defined in the statute, and the law and the bulletin from the Commissioner of Insurance both describe that in a little bit more detail. There is, again, a listing of which plans this prescription drug limit prohibition applies to. Let's finally look at that last language that's included in the bulletin, clarifying some of the language out of the Wisconsin Act 185, the COVID relief law. The Act includes a non-statutory provision that's related to Wisconsin's rules about having mandatory healthcare liability coverage if you're a physician or a nurse practitioner who's temporarily practicing in Wisconsin, even if Wisconsin's not your primary place of practice. Typically, you're going to have a mandatory insurance filing. And instead, this law gives a little flexibility to simply file a certificate of insurance with the insurance commissioner. They're trying to be a little bit more flexible and responsive to the needs of frontline workers to fill in some positions where we might not have otherwise had them in the state of Wisconsin. We link to that insurance commissioner bulletin as well as Act 185 in its entirety in the description below.